So hello medicos, welcome back to my channel. Today in this video we are going to discuss about the femoral triangle, which is one of the most important topics of the lower limb anatomy. So what is actually femoral triangle? So it is a triangular depression. Right? It is a triangular depression which is located at the upper medial aspect of the lower limb. Okay, upper medial aspect of lower limb, and that to which part of the lower limb? Anterior surface of the lower limb. Okay, then see, this is your lower limb and this is the anteromedial surface where there is a presence of depression. This area is known as the femoral triangle. So in this video we are going to discuss the boundaries: the superior boundary, the lateral, the medial boundary, the roof which forms the femoral triangle, and the floor of the femoral triangle. We'll also discuss about the contents later in this video, so stay tuned. Beginning with the boundaries of the femoral triangle, the lateral boundary of the femoral triangle. See, this one is the lateral boundary of the femoral triangle, which is formed by the sartorius muscle. This is the medial boundary, which is formed by the adductor longus muscle. And this is the superior boundary, which is formed by the inguinal ligament. Superior boundary, which is formed by the inguinal ligament. This inguinal ligament, do you know what is the extent of the inguinal ligament? So medially it is attached to the pubic tubercle, and laterally it is attached to the anterior superior iliac spine. So let's study it in details. Lateral boundary, as you know, sartorius. Medial boundary, again, adductor longus. Superior boundary, inguinal ligament. Apex. So where is the apex formed? See, apex is formed at the junction where the sartorius muscle and the adductor longus muscle intersects. Okay, so where is the apex formed? It is formed at the point of intersection, of the sartorius and adductor longus muscle. So see, this is your medial boundary, medial and lateral. Okay, so this is your medial boundary formed by adductor longus. And this one is the lateral boundary, which is formed by the sartorius muscle. So now let's come to the floor of the floor of the femoral triangle. This floor of the femoral triangle is formed by these muscles. Okay, it's formed by these group of muscles. This group of muscles forms the floor of the femoral triangle. So what does it include? It includes iliacus muscle, iliacus muscle. Then it includes psoas major tendon, then it includes this one, pectineus muscle, and lastly it includes adductor longus muscle, which also forms the medial boundary of the femoral triangle. So see this picture, this is the atlas. This one is the iliacus muscle, this is the psoas tendon, this is pectineus, and this is the adductor longus muscle. Okay. Iliacus, psoas major, pectineus, and adductor longus, and this sequence is from lateral to medial side. Okay, so now what forms the roof of the femoral triangle? Roof is formed by the same. Firstly, you have the skin, then you have superficial fascia, then you have deep fascia. And what is the deep fascia of anterior aspect of thigh known as? It is known as fascia lata. Okay. Now there are other stuffs which are included in the roof of femoral triangle. These are the arteries, the cutaneous arteries, the cutaneous veins, and the lymphatics. Okay, we'll write it here. First skin, then superficial fascia, then fascia lata, which is the deep fascia of thigh. Then we have, okay, so we have these arteries. Okay, superficial, epigastric artery, then superficial external pudendal artery, then we have superficial circumflex iliac artery. Okay, we have studied it earlier, right? In the fascia of thigh. See this one, the superficial epigastric artery, superficial external pudendal artery, and the superficial circumflex iliac artery. These are involved in the roof of this one, femoral triangle. There are more. Let's come to this part. This cutaneous veins. These are of similar name. Just you have to replace it with veins. Superficial epigastric vein, superficial external pudendal vein, superficial circumflex iliac vein, and the vein which they are the tributaries of. And what is that vein? Great saphenous vein. And there are lymphatics as well. Lymphatics. What are the lymphatics? We have already discussed in the fascia of thyroid. There are medial group of lymphatics, vertical, horizontal. This one. superficial inguinal lymph nodes. Okay, the lateral horizontal, the upper vertical, the lateral horizontal, the upper vertical, the lower vertical, and the medial horizontal. So we'll write it as superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Okay. Now heading to the contents of the femoral triangle, we gotta learn a mnemonic. It is NAVEL. Okay, NAVEL from lateral to medial side. From lateral to medial side. Laterally we have nerves, then arteries, then veins. Okay, and lymphatics. Okay. So let us label this diagram. We have this. This is the lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh, which is placed the lateral most of the femoral triangle. Okay, in the lateral most aspect of the femoral triangle. Then this green sheath like structure, this is known as femoral sheath. We'll discuss in the later videos. Femoral sheath. It has 3 compartments. In the lateral compartment we have femoral artery and femoral branch of the genitofemoral nerve. Femoral branch of genitofemoral nerve. In the intermediate compartment we have femoral vein. We have femoral vein, and in the medial compartment, which is also known as the femoral canal. Okay, this medial compartment is also known as femoral canal. Femoral canal, which has fats as well as lymph node of Clockwitt. Lymph node of Clockwitt. And this lymph node of Clockwitt is the deep inguinal nerve. Deep inguinal lymph node, sorry. Okay. So see another diagram showing the contents of femoral triangle. Again we have the same mnemonic, NAVEL from lateral to medial side. Okay, so see, this is the lateral aspect. We again have this one. What is this? Lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. Then we have femoral nerve, which divides into 2 divisions, anterior and posterior divisions. And what is the basis of division? This artery. This is a branch of the profunda femoris artery. Okay. So next we have this one, femoral artery, femoral artery. Then we have femoral vein, and we have these deep inguinal lymph nodes. Okay. Remember another thing. This one, just above the femoral artery, there lies another nerve, which is the femoral branch of the genitofemoral nerve. The genitofemoral nerve. Okay. So let me write the contents from lateral to medial again. I hope you'll just remember it in this video itself after repeating it so much times. Okay. So laterally, we have this one, lateral cutaneous nerve of thigh, Then we have another nerve, which is femoral nerve. Its anterior and posterior divisions. Then we have femoral artery and its branches. You remember the superficial epigastric artery, superficial external pudendal artery, superficial circumflex iliac artery. Then we have profunda femoris artery. Okay, see, this one is the profunda femoris artery. Okay, so next we have this one, genitofemoral nerve, femoral branch of the genitofemoral nerve, femoral branch of genitofemoral nerve. Then we have the femoral vein, which has tributaries of great saphenous vein, which in turn has the tributaries of these veins. We just need to change the arteries as veins. Okay, next we have what? Deep inguinal lymph nodes. Deep inguinal lymph nodes, or the lymph node of Clockwitt. Present in the femoral canal. Okay, where is this present? This is present in femoral canal. I hope you're understanding it, right? You'll just remember it in this video itself. We have repeated it so many times. And another stuff which is very useful for keeping all the structures in position, and that is fats. Okay, so coming to the clinical correlations of the femoral triangle, first we have femoral pulse. So where do we find the femoral pulse? It is found midway. Okay, midway between between the anterior superior iliac spine and the pubic symphysis, pubis symphysis. Between the anterior superior iliac spine and pubic symphysis. It is actually a surface anatomy topic. I'm covering it here itself. Angiography. So the femoral artery is used for angiography. Like they put the angiograph via the femoral artery, which is an easier way to reach the heart. Embalming is done for the preservation of cadavers. Where they empty the blood vessels. By draining it through the femoral artery. Suppose there is an injury or trauma in the femoral artery, then if you press the femoral artery, it helps in major bleeding control. Okay, so venous cannulation is also done through the femoral vein. In deep vein thrombosis, okay, you see this. Deep vein thrombosis. There is incompetence of the valves of the superficial veins, due to which there can be clot formation in the femoral vein, after which the superficial veins get swollen up and this results in varicose veins. Okay, we'll discuss in the venous drainage of the lower limb in the later videos, so stay tuned. And how due to formation of clot, okay, due to formation of clot in venous blood vessels. What do you mean by femoral nerve block? Femoral nerve block, okay, so it is given during anesthesia. When we give anesthesia or during any surgery related to the anterior aspect of the thigh, then the anesthesiologist, they give the anesthesia and blocks the femoral nerve so that the sensations from these anterior aspect of the thigh are gone. Okay, and it results in transient paralysis of anterior muscles. Transient paralysis of anterior thigh muscles. In case of any infections, maybe bacterial infection or this parasitic infections, okay, the deep inguinal lymph nodes or the lymph nodes of Clockwood, they get enlarged and we can palpate it through the femoral triangle. Can be palpated in the femoral triangle. Lastly, we have the Suez abscess, which is the last clinical correlation of this femoral triangle. So what is it? Suez abscess is nothing but it is pus formation within the Suez major muscle. Okay, within Suez major muscle. See, the Suez major muscle originates from this one, lumbar vertebra. Okay, and there is formation of pus. which this pus then it's drained into the femoral triangle. Here is the femoral triangle. This pus gets drained into the femoral triangle and this gets accumulated. Accumulation in the femoral triangle. Okay, so this was abscess you'll deal more in the microbiology second year MBBS, so stay tuned. I hope you understand. I hope you're understanding my videos. If these videos are of use, then please don't forget to like and subscribe my channel. Thank you, Maricos. Bye bye. See you later.